A lot of Americans are upset right now, and for good reason. Their insurance premiums are going to double by the year 2026, and there's nothing anyone can do about it. If this is happening to you and your family, let's get the discussion started in the comment section. Let's get into the video.
Depending on where you live, your health insurance premiums might go up from 20% to as high as 59% increase heading into next year. People are about to make open enrollment decisions in a few weeks, and I think millions of Americans are going to be in for a sticker shock. What do you think?
So the first video I seen this morning when I woke up was a video about our insurance, right? And so I'll just use me for an example. I pay a little over $600 a month for medical, dental, vision, and all of that, through my job. I pay a little over $600. So that's a little over $300 every 2 weeks. And that's for 2025. But for 2026, it's going to be like $2,100. It's going to be over $2,000 a month for medical, dental, and vision because of the things that's happening in our country or whatever. And whatever it was that Trump did, which I don't know, but it gave me anxiety so bad. Because here's why. If I have to now pay $2,100 a month for benefits, I won't be able to afford it. I can't pay $2,100 out of my work check, or I won't have a check, right? I'm spending my whole work check paying for benefits. This is so crazy. Now, tell me more about this. But again, this is the first video I seen when I logged into TikTok today. I did reach out to my to Anthem, but it's the weekend. I wasn't thinking. I just reached out immediately because it gave me a little bit of anxiety, because open enrollment is next month, and I am going to have to decide if I'm going to go a year or two without insurance at all, right? Open enrollment starts in November, and I'm going to have to make a decision. Do I go ahead and get everything taken care of this year, go ahead and get mammograms, get everything I need to get done before the end of this year, and then next year go without insurance so that I can pay for my bills and housing and food and things, so I can pay to even live? Like, what? So I gotta choose between having health benefits and eating? You guys, did anybody else hear about this? Let's talk about it in the comments. Oh my God.
All right, I'm gonna need somebody or like several somebodies to de-influence me, okay? I keep seeing posts on here of people talking about dropping their insurance for the new year, and like, I'm really thinking it sounds like a great idea. Everybody's already paying like a shit ton of money for our health insurance, and then for some reason, if we do go to the doctor or the hospital or something, we're paying more money because we have insurance than if we were to go in there and not have insurance. So like, I'm paying for insurance just so I can pay more money? That doesn't make any sense. People are talking about setting up like a separate savings account and just putting what they would be paying for insurance every week, or like bi-weekly, or from every check, and just putting it into this account, and then having that account for any kind of medical needs. And I gotta say, like, it really makes sense to me, because at the end of the year, you're normally not even having that much go on, like, knock on wood. But I don't know, it's making sense to me. I need somebody to de-influence me, tell me what's wrong with that plan and every in and out between it.
My name is Carla Zimmerman. I just retired in June from 25 years of teaching.
My name is Bartley Armitage. I've been in Eugene, Oregon for most of 45 years. I was a union carpenter for over 30 years, and still a member of the Carpenters Union.
Our current premium is $443 a month.
Through the ACA.
Through the ACA, and which is manageable for us, both retirees. However, it's going up to $2,224 a month. We are kind of in shock. That's without the subsidy. With the subsidy, it's manageable for us. We still live paycheck to paycheck, but it's manageable. The Affordable Care Act, we sort of counted on that in the interim period as retirees to sustain our health care. Without the subsidy, we honestly don't know what we're going to do.
Without the subsidy and with that kind of increase, It's like buying another house and trying to pay for two houses at the same time. Yeah, so we don't know what we're going to do exactly. We don't know how we're going to have some health insurance and be able to afford it on a monthly basis.
The thing that gets me the most is that both of us have worked our whole lives. I always had faith that our government would, when we retired.
The government, that our leaders would have a heart and try to find a way to help everyday Americans.
What I would say is this government should be about we the people, not about some.
Our health insurance cost for me and my family is doubling in 2026. I don't know if this is because we're switching companies or if it's because the speculation that other people have had with their companies of it being a result of the big, beautiful bill. I choose the cheapest option, which gives me the highest deductible, and I was paying $90 biweekly for me and my family, and that does not include dental or vision. For 2026, it's going to be more than double for the cheapest option, highest deductible, $190 bi-weekly. And again, that's before dental and vision. Luckily, dental and vision isn't going to add that much more. And that does include my job contributing to my HSA, depending on how many people I cover. But that is a lot of money for it to just double. If you have gotten the quotes for your 2026 insurance, I'm curious if yours is also increasing, because I'm hearing that a lot of people's are. I actually work part-time, so my paycheck is already very small as it is after a lot of deductions come out. So this is definitely going to change things. We're thinking about just having me and the kids on my insurance, and then seeing if it's cheaper for my husband to have insurance through his job, and just seeing if it's cheaper that way. But that would mean that any medical cost he has, I can't cover through our HSA that we're always contributing to, because he wouldn't be like a covered person under my plan. That's like nearly $400 a month for me and my family. And for years, we've been able to do like a blood draw that gives you money off of your insurance, but there's been no talk of that for 2026. So yeah, what are you guys saying for 2026 insurance?
2026 is shaping up to be the most expensive year for employer-sponsored health coverage in over 15 years. According to Mercer's National Survey of Employer-Sponsored Health Plans, the average health benefit cost per employee is expected to jump 6.5%, and that's after cost-cutting measures. Without those measures, the increase would have been closer to 9%. So this marks the fourth year in a row of elevated cost growth, compared to a decade of increases averaging just 3%. So what's driving this? Two things: higher prices and higher utilization. So on the price side, advances like new cancer therapies and weight loss drugs improve outcomes, but they're expensive. Consolidation of health systems means fewer players with more bargaining power, and inflation, including higher healthcare wages, is adding pressure. So even AI billing tools are being flagged as potential cost drivers. On the utilization side, patients are catching up on care delayed during the pandemic. More staff capacity has opened, and virtual healthcare has lowered access barriers, especially in behavioral health. So employers are responding. Nearly 60% plan to make changes in 2026, most often by raising deductibles and cost sharing. So that means employees may see higher out-of-pocket costs at the point of care. So the bottom line, while innovation and access expand, working Americans are likely to feel the pinch in their paychecks and at the doctor's office.
All right, the health insurance industry is an absolute sham. I don't know how I'm paying $1,500 a month for health insurance, but every single person in my policy has a $6,000 copay, which means I've been going to the doctor all year. I thought my copays went towards our premiums and the amount that we had to pay to get coverage. However, it doesn't. My wife just had a serious event. She had to go to the hospital. She had to have life-saving surgery. And we got a bill in the mail from the hospital for over $3,000 for this procedure. And I'm thinking back, like, I'm paying $1,500 a month for this health insurance. I've personally paid thousands of dollars over the course of this year in copays for myself and stuff that I had to go to the doctors for. So I'm sitting here thinking, like, I'm going to spend $1,500 a month for the next 12 months. What is that? Like 18 grand. And then I have to spend $6,000 a person just to get them to cover things. So you're looking at, we have 5 people in our family. If all of us have to go to the hospital, that's $30,000 in copays that we have to pay on top of the $18,000 in monthly charges to actually get coverage. As a father of 3, I'm strongly considering canceling our health insurance policy, which feels very irresponsible and wrong, but I can't remember the last time I spent over $48,000 in a year in health costs between copays and health insurance and all of this stuff. If I just pay cash, I'm never going to pay anywhere near that amount. For instance, the surgery my wife just had, if we paid cash on that surgery and we didn't have insurance, it would have ran us about $1,200. But because we had insurance and the insurance wasn't going to cover it, we have to pay what the insurance was going to pay, which is over $3,000. Are other families seeing the same thing? Maybe I'm just being unreasonable and crashing out here, but it just doesn't make sense.
Hey, quickly, it shows that 90% of you guys, it shows that 90% of you guys are not subscribed, and it shows that 90% of you guys are not subscribed, and I would love to have you on so that I could keep giving you this content, keeping you up to date on all the latest news.
Health insurance premiums are about to increase by 18% for the rest of the year. Now, a lot of people are like, oh, it's not that much, that's not that bad. In 2026, when the subsidies go away because of Trump and his big, beautiful bill, health insurance premiums are going to be 118% more than they are right now. So if you go on right now, you try to get a health insurance plan in 2025, it's going to cost you around $950 or so on average. In 2026, when you try to get a health insurance plan on healthcare.gov, your premium will be around $1,900. So people are then going to have to decide, do I want to pay my mortgage or do I want to have health care? It's fucking crazy.
I mean, these are insane numbers. States are now starting to release the actual numbers on what the Republicans' policy changes have done to health insurance costs with this legislation that they've passed this year. This is what the Democrats have been making a stink about. You've heard, like, Democrats are concerned in the shutdown fight about healthcare costs and health insurance, and you think, like, oh, Democrats are always concerned about health costs. That's nice. I care about health costs. I'm glad they're standing up for it. No, it's this specific thing. You want to know what the Democrats are making a stink about with the shutdown? You want to know what the Democratic side is of the fight over the shutdown? Look at these numbers from the New York Times tonight. Look at this. This is for the tens of millions of Americans who get their health insurance through the online marketplaces. Look. Based on the newly posted information, meaning the pricing information that's now being posted in multiple states, a family of 4 making $130,000 in Maine, so you combine the family's income, everybody's salaries, you got to do $130,000, that family would face an increase in their annual health insurance premiums next year of $16,100. That's how much their health insurance premiums would go up. But maybe that's, that sounds like it's a fairly well-off family, and you think, oh, well, maybe that doesn't apply to me. I'm not quite in that kind of a bracket. Well, imagine you're in a couple, you're each 60 years old, and you put both your salaries together combined, you make $85,000 a year. So maybe one of you's making 40 grand a year, maybe one of you's making $45,000 a year. Combined, your couple's income is $85,000 a year. In Maryland, your insurance premium is going to go up by $13,700. In Minnesota, your insurance is going to go up by $15,500. In Nevada, it's going to go up by $18,100. In Kentucky, the increase for you guys as a couple will be that you are expected to pay an additional $23,700 per year. That is the amount of increase we are looking at in people's health insurance premiums. Can your family afford just randomly an additional charge of $24,000 for exactly what you're getting right now for $24,000 less than that? I mean, these are insane numbers. But this is what Republicans, in their policy changes on healthcare, what they have done to health insurance costs. And this specifically is what Democrats have been screaming bloody murder about. This is what Democrats have been drawing the line about in this shutdown, telling Republicans that this is the thing they need to fix. Think they're going to fix it? Think they will? President Trump doesn't appear real focused on it.
Just so we're clear, it's not just low-income people that are being affected by everything that the gov is doing right now. Even if you have a job making $50,000 to $75,000 a year, and you pay for insurance out of your paycheck every week, 2 weeks, whatever, your premiums are going to go up. And exponentially, may I add. So, before y'all were choosing to pay the bills or to have food, now you have to choose between your health, paying your bills, and having food. America, are we great yet? Let me know.
I just watched a video this morning. A lady's renewing her health insurance for her and her husband and her family. And she said they were paying with all the add-ons, I think it was like $500 and some a month for medical insurance and 401k and all that other stuff, vision, dental. She just opened up to go on open enrollment for the new year. Insurance for the month, $1,500 a month. That's tripled from $500 to $1,500 a month. Now, I want to ask you, if this happens, if you open up your insurance and you go to enroll and they're going to charge you another $1,000 a month, can you pay for that? No, I can't. So I'm thinking to myself, if this was to happen to me, or if it did happen to me, I'd have to drop my insurance. I have to drop my insurance and start eating as healthy as I can and just pray to God nothing happens where I end up in a damn hospital and got to pay the bill because I'm not spending $1,500 a month for health insurance. And then Dr. Oz has the nerve to say, we're underbabied. Who can afford to have a baby in this economy? People at the gas pumps can't afford to put more than $3 or $4 in their gas tank. People having to put their kids' snack back because they just can't afford it. They have to get the staples, meat, vegetables, milk, a box of cereal, a couple 2 or 3 bananas. That's all you can afford, but no more cookies or any kind of like a snack that a kid would, normally want from the store. But yeah, they say we're underbabied. Who wants to right now with an economy like this? Do you want to get a nut? Didn't think so. But I got thinking about this too. A 1.5 trillion tax cut for the 1%, the wealthiest people in the world, the billionaires and trillionaires. What do they need a tax cut for? They're in their loafers in front of their fireplace sipping on a Chardonnay, and people are trying to figure out how they're going to afford to buy a 12-pack of eggs. Maybe we should buy 6 and just give the kids half as much breakfast as they normally eat because we can't afford to buy a dozen eggs. None of this makes sense anymore. People get mad at me for the videos I make, but I'm just being honest and real. I don't care if Republican or Democrat. All I want you to do is take care of the people that pay the taxes to keep this country going.
If you thought the government shutdown was bad, if you thought federal government workers not getting paid was bad, if you thought military personnel not being paid was bad, wait till you hear this one. Anybody looked up the insurance premiums for 2026? I'm really talking to the working class dumpster divers in particular. The increase varies from state to state, but I've seen as low as $13,700 all the way up to $23,000 $20,700. That's how much your insurance will go up for 2026. If you don't believe me, go look it up. And y'all still sitting up here talking about this dumpster is good for this country. Like, you still saying that shit with a straight face and with your whole chest. I want to see you say that shit when you paying $20,000 more for your family to have health insurance. I'll wait.
Today, my job released our open enrollment. It started today. I am currently paying $240 every 2 weeks for health insurance for a family, correct? Now, that does not include my vision, dental, 401k, or disability. So when you add all of those in, I'm paying about $550 every 2 weeks for my entire family to have medical, dental, vision. I have disability coverage, and I also contribute to my 401k. We just got our benefits for next year. What I'm currently paying $240 every 2 weeks for is going up to $709 every 2 weeks. That does not include my 401k, my vision, my dental, my disability insurance. How can I possibly survive paying $1,500 just in medical coverage? They already kicked our spouses off of our coverage because they said if your spouse can get insurance through their job, we're cutting them off. So not only did you cut them out, it tripled. $700 just for medical benefits every 2 weeks. I'm not even talking about a month. This is bi-weekly. How is this? And I work in medical. How is this fair? How does this work for anybody? I can literally cry. I have a daughter that's graduating college next year. I have a daughter that's getting married next year. On top of that, we have to live. How? How can anybody live spending just $1,500 a month just in healthcare that doesn't cover our dental, that doesn't cover our vision? On top of that, there's a $2,000 deductible and a 20% co-insurance. So either way, anytime we go to the doctor, anytime we do anything, we got to come out of pocket. On top of what I'm already paying. When in the is this nation supposed to be great again? Because it's getting worse.
The health insurance industry is an absolute...
So I just opened a health insurance letter telling me what my premium is going to go up to in 2026. Currently I pay like $27 a month, Affordable Care Act or tax credit or whatever. Health insurance premium for me is going up to $511 per month in 2026. I will be responsible for $511 a month for health insurance. I'm just going to be transparent about what my income is. So per the IRS, I have to pay myself a reasonable salary for the role that I do at my company. I pay myself $40,000 annually. It works out to be 40-hour work week, like $19 and some change per hour. Which, by the way, I actually do not think $40,000 is a reasonable salary for the work that I do. Which makes me getting paid lower at an hourly rate than my staff. However, I don't work 40 hours a week. I probably work 80 hours a week, so I don't know, it's even less than that. All this to say, if I wanted to get on Medicare, the most I can make per year is just under $17,000 a year. I make too much money to be on Medi-Cal, but I don't make enough to pay for health insurance. If something were to happen to me catastrophic, like, I don't know what I would do. I'm 45 years old. I need to be having certain cancer screenings and If I could pay myself less, I would. More back into the business. Also, like $40,000 is like barely enough to live on in California. Most of my salary goes towards paying for gas in my car. It's gas and groceries is what I spend all my money on. Anyway, I don't have an ending to the video. That's all I wanted to say.
All right, so if these insurance price changes have hit you and they're affecting your family, let's get the conversation started, and I'll catch you guys in the next one. If you like this video, then I'm sure you're gonna like this one. I'll see you later.